Welcome! Today, we're diving into the world of Compassionate Allowances cases, a special Social Security Administration initiative designed to help people with severe medical conditions get benefits faster. If you or someone you know is facing a serious illness, understanding this process could make a huge difference. In this video, we'll break down what a Compassionate Allowances case is, who qualifies, and how the process works. Let's start by exploring the basics and why this program exists in the first place. The Social Security Administration created the Compassionate Allowances program to address a critical need. Some medical conditions are so severe and obvious that waiting months or years for benefits just isn't fair. This initiative ensures that people with the most serious disabilities can get help quickly without unnecessary delays. By identifying these cases early, the SSA can prioritize them, providing much-needed financial support to individuals and families during extremely challenging times. So, what exactly is a Compassionate Allowances case? In simple terms, it's a fast-track process for Social Security disability benefits. Certain medical conditions are so clearly disabling that the SSA has a list of them. If your diagnosis matches, your application is flagged for expedited review. This doesn't mean you skip the application process, but it does mean your case moves to the front of the line, reducing wait times dramatically. The Compassionate Allowances program is managed by the Social Security Administration, or SSA. This federal agency is responsible for evaluating disability claims and ensuring that those who qualify receive their benefits. The SSA continuously updates its list of qualifying conditions, working with medical experts, advocacy groups, and the public to make sure the process is fair and up to date. When you apply for Social Security disability benefits, your application is reviewed for any signs that you might qualify for a Compassionate Allowances case. If your medical records or diagnosis match a condition on the SSA's list, your claim is automatically flagged for expedited processing. This means you could receive a decision in weeks rather than months or years, helping you access benefits when you need them most. Not every medical condition qualifies for a Compassionate Allowances case. The SSA maintains a specific list of diseases and disorders that are considered so severe they almost always meet disability standards. These include certain cancers, rare childhood disorders, and advanced neurological diseases. The list is updated regularly to reflect new medical knowledge and feedback from the public. Some examples of conditions that qualify for Compassionate Allowances include ALS, Lou Gehrig's disease, certain aggressive cancers like pancreatic or liver cancer, early onset Alzheimer's disease, and rare childhood disorders such as Batten disease. If your diagnosis matches one of these, your case is likely to be fast-tracked by the SSA. The SSA doesn't create the Compassionate Allowances list in isolation. They consult with medical experts, advocacy organizations, and the public to identify which conditions should be included. This collaborative approach helps ensure that the list is comprehensive and reflects the latest medical understanding. Applying for a Compassionate Allowances case starts the same way as any other Social Security disability claim. You'll need to complete the standard application and provide detailed medical documentation. The key difference is that if your condition matches the Compassionate Allowances list, your case is automatically prioritized for faster review. To qualify for a Compassionate Allowances case, you'll need to provide thorough medical records. This includes doctor's notes, lab results, imaging studies, and any other documentation that clearly shows your diagnosis. The more complete your records, the easier it is for the SSA to confirm your eligibility and expedite your claim. One of the strengths of the Compassionate Allowances program is its use of technology. When you submit your application, the SSA's system scans for keywords and diagnoses that match the qualifying conditions. If there's a match, your case is flagged for expedited review, helping you get a decision as quickly as possible. A common question is whether you need to fill out a special application for Compassionate Allowances. The answer is no. You simply apply for Social Security disability as usual. If your condition is on the list, the system will automatically identify your case for fast-tracking. One of the biggest benefits of a Compassionate Allowances case is speed. While regular disability claims can take months or even years, Compassionate Allowances cases are often decided within a few weeks. This rapid turnaround can be a lifeline for people facing urgent medical and financial needs. People most likely to qualify for Compassionate Allowances are those with diagnoses that are clearly listed by the SSA. If you have a rare or aggressive disease, or a condition that is universally recognized as disabling, your chances of being approved quickly are much higher. Always check the current list to see if your diagnosis is included. Compassionate Allowances aren't just for adults. Many qualifying conditions affect children as well, including rare genetic disorders and certain cancers. The SSA's list includes several childhood diseases, ensuring that young patients and their families can also benefit from expedited support. The SSA regularly reviews and updates the Compassionate Allowances list. This ensures that new medical discoveries and rare conditions are considered. If you or your doctor believe a condition should be added, you can submit suggestions to the SSA for review. Medical experts play a crucial role in the Compassionate Allowances program. They help the SSA determine which conditions are severe enough to warrant expedited processing. Their expertise ensures that only the most serious and well-documented cases are included on the list. Advocacy groups are also involved in shaping the Compassionate Allowances program. They represent patients and families, providing valuable feedback to the SSA about which conditions should be prioritized. Their input helps keep the program responsive to real-world needs. The SSA encourages public input when updating the Compassionate Allowances list. Patients, families, and healthcare providers can all suggest new conditions for consideration. This open approach helps ensure the program stays current and effective. If you're wondering whether your condition qualifies, the SSA's website has a complete, up-to-date list of Compassionate Allowances conditions. You can search by disease name or category to see if your diagnosis is included. This is the best way to confirm your eligibility before applying. If your condition isn't on the Compassionate Allowances list, you can still apply for Social Security disability benefits. Your case will be reviewed under the standard process. However, you or your doctor can also suggest that the SSA add your condition to the list for future applicants. It's important to remember that being on the Compassionate Allowances list doesn't guarantee approval. You still need to provide solid medical evidence and meet all other eligibility requirements. The expedited process simply means your case will be reviewed faster. Compassionate allowances apply to both Social Security Disability Insurance, SSDI, and Supplemental Security Income, SSI, programs. Whether you're applying for one or both, the expedited process can help you get benefits faster if you qualify. Getting approved for benefits quickly can make a huge financial difference for people with severe illnesses. Compassionate allowances help reduce the stress of waiting, allowing families to focus on treatment and recovery instead of worrying about money. Beyond the financial impact, compassionate allowances provide emotional relief. Knowing that your case will be reviewed quickly can ease anxiety and help you concentrate on your health and well-being during a difficult time. Some people think that compassionate allowances mean automatic approval or that anyone with a serious illness qualifies. In reality, only specific conditions are eligible, and you still need to provide strong medical evidence. Understanding the facts can help you avoid disappointment and prepare your application properly. Your healthcare providers are key partners in the Compassionate Allowances process. They can help you gather the necessary documentation and ensure your diagnosis is clearly stated in your records. Their support can make a big difference in how quickly your claim is processed. Some applicants choose to work with legal professionals or disability advocates when applying for benefits. These experts can help ensure your application is complete and that all necessary evidence is included, increasing your chances of a smooth, expedited review. If your Compassionate Allowances case is denied, you still have the right to appeal. The appeals process allows you to submit additional evidence or clarify your diagnosis. Persistence and thorough documentation can sometimes lead to a successful outcome on appeal. It's important to keep your medical records up to date throughout the application process. New test results, doctor's notes, or changes in your condition should be submitted to the SSA as soon as possible. This helps ensure your case is evaluated with the most current information. The SSA will communicate with you throughout the Compassionate Allowances process. Be sure to check your mail and respond promptly to any requests for additional information. Quick responses can help keep your case moving forward without unnecessary delays. Once your Compassionate Allowances case is approved, you'll begin receiving benefits according to the rules of the program you applied for either SSDI or SSI. The SSA will provide details about payment amounts and schedules so you know exactly what to expect. Even after approval, you may need to provide updated medical information to the SSA from time to time. This helps confirm that you still meet the eligibility requirements for benefits. Staying proactive with your records can prevent interruptions in your payments. If your medical condition improves or your circumstances change, it's important to report these changes to the SSA. This ensures that your benefits are adjusted appropriately and helps you stay in compliance with program rules. In addition to Compassionate Allowances, there are many other resources available for people with severe medical conditions. Local nonprofits, advocacy groups, and government agencies can provide additional support, from financial assistance to counseling and transportation services. The rules and qualifying conditions for Compassionate Allowances can change over time. It's important to stay informed by checking the SSA's website or speaking with a disability advocate. Keeping up to date ensures you don't miss out on new opportunities for support. To make your Compassionate Allowances application process as smooth as possible, gather all your medical records before applying, double-check your documentation, and respond quickly to any SSA requests. Being organized and proactive can help you get the support you need without unnecessary delays. Some common mistakes applicants make include missing medical records, incomplete forms, or failing to update the SSA about changes in their condition. Avoiding these pitfalls can help ensure your Compassionate Allowances case is processed quickly and accurately. The amount you receive from Social Security disability benefits depends on your work history, for SSDI, or financial need, for SSI. Compassionate allowances don't change the benefit calculation, they just speed up the approval process. The SSA will explain your benefit amount after approval. Compassionate allowances benefits last as long as you continue to meet the eligibility requirements for SSDI or SSI. If your condition improves or your circumstances change, your benefits may be adjusted or stopped. Regular reviews help ensure continued eligibility. If you live outside the United States, you may still qualify for compassionate allowances, depending on your citizenship and the type of benefits you're applying for. Check with the SSA for specific rules about international applicants and benefit eligibility. The SSA provides information about compassionate allowances in multiple languages and accessible formats. If you need help understanding the process or completing your application, resources are available to assist you regardless of your language or disability. To recap, compassionate allowances are a vital part of the Social Security disability system, helping people with the most severe conditions get benefits quickly. The program relies on a specific list of qualifying conditions, thorough documentation, and a streamlined review process. Staying informed and organized can help you take full advantage of this important resource. If you have questions about compassionate allowances or need help with your application, the SSA's website is a great place to start. You can also reach out to disability advocates, legal professionals, or local support organizations for personalized assistance. Compassionate allowances can be a lifeline for people facing serious medical challenges. By understanding how the program works and what's required to qualify, you can navigate the process with confidence. Remember, help is available, and you don't have to face this journey alone.